Today, we're talking about something that can feel overwhelming, chemotherapy. But at SCOA, patients are never alone. Prior to starting chemotherapy at SCOA, patients are offered an entire visit with a nurse in order to be educated on the treatment about to be delivered. This visit is designed to give the patients time to ask questions and hear directly from a nurse what they can expect. This is comprehensive cancer care close to home. Today, I'm here with some lovely ladies here at SCOA. Please introduce yourselves.
I'm Misty Goldstein. I'm one of the chemo infusion nurses here at SCOA.
I'm Catherine Stoner. I am the charge nurse for the infusion area, but I also do chemo teaching and help with the oral adherence program.
And for those who are not familiar, can you explain a little bit about what chemotherapy is?
Chemotherapy specifically is targeting of cancer cells. Generally, though, it affects healthy cells as well. So there is a difference between chemotherapy and the new emerging immunotherapies that are being used a lot. But we give both of those as well as oral chemotherapy drugs. So there are a number of different regimens, a number of different cancers that they treat.
When people come in, the first thing they do is, they're trying to understand their diagnosis. So when they come in and they have teaching, which is a class that you'll go to before you come to the infusion to see me, but a lot of times the patients don't always get it because they're overwhelmed. And they've also just dealing with the new diagnosis. So even though you have an education course when you come in about the drugs that you're going to have, where you're going to be, who your nurses are going to be, it's very important to know that you're going to be re-educated by the infusion nurses the whole time, throughout your whole regimen.
One thing that is very special about SCOA is that we have chemo nurses that are doing the teachings, and that the patients come in before they start chemotherapy. They don't come in generally, unless it's very last minute, they don't come in the day of treatment and then go straight to treatment. They come in a few days before or a week before so that they have time to digest the material, have time to think of questions. Having a support person there for them to say, hey, remember you were going to ask them this, or have a list of questions already written, or it's just a second brain there that knows things that the patient may know, but that they're just in a whole different place at the moment.
I want people to know that this is not a scary place.
Right.
The diagnosis is scary. We get that. We understand that. We are your cheerleader and your friend and your caretaker. And we are a little bit comic relief sometimes because you kind of need that on some days. And we will laugh with you. We will cry with you. We will do all the things with you. But I don't want people to be scared because of what they see on paper. I want them to come in, and once they experience, they will have the confidence knowing that they're in a good place and it's going to be okay.
So you talked a little bit about side effects earlier. So what are the side effects and how do you guys manage those?
So side effects come in a variety of types. Some people have some worse than others. It could be nausea, it could be vomiting, it could be diarrhea, it could be fatigue is huge. So all of these things we are assessing when they come into the infusion center based on what they're getting. And some people have everything, and some people have nothing, and some people have a little bit of both. Now, another thing is, obviously people lose their hair sometimes too, and that men and women, not just women, it really does affect them. So we give emotional support in the infusion center, and then we have some other things that we can do to help manage that and maybe prevent it.
For some people who are not familiar with the DigniCap, can you explain a little bit about what that is?
Yeah, so right here to my right is actually one of our DigniCap machines that we use here in the office. What the purpose of it is to prevent hair loss from chemotherapy. So the patients will come in and it's a cold cap that freezes their scalp. So they'll wear it during their chemotherapy to prevent that hair loss. So if they choose to use the DigniCap, what they'll do is order it ahead of time. They come with a separate cap. This hose right here connects to it, so everyone has their own cap. And you'll receive this little bag from DigniCap. It has your own cap in it, a hairbrush, and a spray bottle so that we can wet their hair before the application.
Having this service, does that help alleviate like some of the choices or options when it comes to wanting to do chemotherapy? Because I know some people could be a little wary of like their hair loss and such.
Yeah, so I mean, obviously the DigniCap's purpose is to prevent hair loss from chemotherapy, which is one of the main side effects from chemo. And every person varies their reasoning for wanting to use it. But one of the main reasons I see people using it is if they don't want other people to know, whether it's family members, if they have young kids, if they teach, anything like that. So they don't want others to know about their diagnosis. So this can alleviate some of that stress of the fact of not having to lose their hair during the chemo.
I will say too that sometimes they'll do chemotherapy and then they'll switch to immunotherapy after so many sessions of chemotherapy. And with immunotherapy, you don't have that stress of losing your hair. So sometimes the DigniCap is only done for so long. And then after that, they don't have to do that anymore.
What makes SCOA's approach different and unique from other centers?
Yeah, so we are the only facility in the Midlands that uses this DigniCap machine, so it's just a great way for us to be able to connect with our patients and give them that availability to keep their hair during their chemotherapy treatments, which I know is a big stress on a lot of patients.
And I will say too that it's not just for women. A lot of people think that this is strictly for women. I've had 2 men just recently use it. And a lot of times it's very important to them too. And sometimes for the same reason, family or job or whatever, or sometimes they just like their hair. And that's okay. And we embrace that. So men and women can benefit from this, and that is a good thing.
Well, thank you so much, Misty and Lauren, for taking the time to educating me, educating everyone. So thank you so much.
Yeah, thank you for
Thank you, it
having
was a pleasure.
Yeah.
Thank you for joining us today, and thank you to the amazing chemo nurses for educating us on these important topics. Keep tuning in because we have many exciting upcoming segments to learn more about the great care being given by the SCOA team. If you scan that QR code, it will take you to the SCOA website if you want to learn more or request an appointment.